Welcome back to the Federal Executive Forum on Federal News Network. We're talking about healthcare IT and the federal service. And we're going over use cases. And Tom, I'm going to throw it over to you at Verizon. You're working with a lot of these agencies across the spectrum. Give us an example of a specific program you'd like to highlight for the audience.
Yeah, I appreciate it, Luke. There are so many different use cases that we've been working on with both the commercial and the federal healthcare systems over the past few years, whether that's the augmented reality solutions that we implemented within the VA innovation ecosystem, which allows the physician to actually look inside, virtually look inside a patient's body to identify where cancer may need to be removed, whether that's a zero rating of the VA Video Connect application that we did over our network, so veterans can contact their physicians without using their data on their wireless devices. We've really been working closely with not only commercial, but also the VA with their connected healthcare department on telehealth devices and remote patient monitoring solutions. The one that is probably newest for us, so is as a company, we've bought a company called Blue Jeans, and we've developed that video conferencing platform into a telehealth platform. And we've integrated that into a lot of the common EHR systems that are available and that are being used out there in the space today. The cool thing about this is we actually created customer advisory boards, and we're taking feedback from customers in regards to how we can continue to evolve this application over time to meet the future needs of our customers and their patients.
I really love the idea of these video techniques. It's no longer the VTC standing over in the corner on the wall, right? It's really integrated, fused into the solution up the value chain. Really makes a big difference. Lisa, you know, we're talking about a lot of different pieces and parts of the ecosystem here, but it all starts with the North Star, as you pointed out at the beginning of the program, and these standards and the strategy that has to be put in place so that we're all pointed in the right direction. Give us a specific example of some of the activities that you all have laid, the tracks that you've laid down that have really helped to enable all this capability to happen.
Absolutely. Thank you, Luke. And I just first want to start by saying I take my hat off to my colleagues at VA and DoD and all the work that you all are doing. Is just amazing work. And as the granddaughter of a World War II veteran and the daughter of a Vietnam veteran, I just want to say thank you for the work that you are doing. As far as ONC, we really lay the infrastructure, as you've heard from my colleagues, we lay the infrastructure that allows the data to flow in a standards-based way. And so one specific example is our 21st Century Cures Interoperability Rule. And so as the provisions of that rule are starting to take effect, we're seeing a lot of what we have worked on for years, actually, to make this happen. So VA and DoD, the work that they are doing, that was from prior rules. What you are going to see in the future based on this rule is we require a standards-based, specifically FHIR-based, which is Fast Healthcare Interoperability Resources-based APIs, so that we don't have to build, 1,000 different APIs in order to interface with different electronic health records. We also put in provisions in regard to information blocking. So we outlined the exceptions because it is our position that a person's information should flow in a safe and secure manner to wherever they need it to flow and give permission for it to flow. And so in our rule, we also address information blocking, and specifically something that you may be seeing in your personal lives is faster test results. So a lot of you are probably starting to see notices from your doctors that say you may get your test results, sooner, quicker. Just make sure that you are prepared to read your results. And we work to make sure information is available because we believe that information is power. It is the great equalizer. It allows us individually as patients, as caregivers, to be able to be active participants in our care. And so our rules have an impact, not just in the government space, but across industry and in our lives personally. And so we have considered that a great honor to be able to provide that infrastructure that the industry rides upon.
Well, everybody in this country, I'm sure, certainly on behalf of everyone in this country, thank you for that, because you're right. I mean, the results are coming in quicker. They're online, accessible, secure, and that's much appreciated. And I think it's very important for the health community and the community at large. Nicholas Spees, let's talk about a specific program that you've been working on. I can't imagine there must be dozens of them that you've been working on across the community in regards to a good use case in respect to healthcare.
Yeah, thanks, Luke. We've had so many programs that have been made more successful by, again, the data collaboration and researching piece. But I want to focus specifically on the state of California's COVID response. In a very short period of time, COVID ramped up very, very quickly. And one of California's biggest concerns was not just where do we have the right materials to deal with this, but where is the spread actually occurring? What sort of activities are we seeing that folks will do that is more risk or less risk? And so they teamed up with Snowflake to build out an infrastructure that could very quickly respond and provide dashboarding for the governor and for a lot of the officials out in the state of California, but also could report that information up to the federal government, to the CDC, and to other states and counties. And the most important part of this, and the part that I like the most, because I keep talking about data collaboration, is their researchers in California were in a completely different cloud provider and a completely different area of the new infrastructure. So California had to be able to bring the data in locally to their cloud infrastructure because of contracting and procurement, but then also collaborate with somebody else on a completely different cloud, which in modern software as a service offerings like Snowflake, that's relatively simple and easy to do. So we were able to support the research as well as the response to COVID-19. We're very proud of that work.
Wow, sounds like a fantastic use case, and I'm glad to hear that. Again, this plethora of data getting used in a very elegant way. Pat, let's go to you and talk about sort of the infrastructure piece of this. You said that you're involved with making sure that the network's there, it's reliable, it's secure, and available from just a high-speed capability. Give us a use case, if you will, a program that you'd like to highlight along those lines.
Sure. Yeah, there's dozens, and of course with COVID and mass telework, that was a real world test of was the new network going to work or not, and it did. But what I also
instantly, I might add,
yeah, but I also want to highlight some of the software we built. So we have something called the Military Health System Information Platform. And it is kind of the crown jewels of all data, all the medical data in the DoD. And, the way our agency was born, we had, an Army repository, a Navy repository, an Air Force repository, one that was in the National Capital Region. And this combined all of them, shut down those data centers. And as of June of last year, it is now in the cloud, technically at Amazon. And that all being in one place under one roof really enabled us to do wonderful things, tracking who had COVID, how it was spreading, and the vaccine distribution, those kinds of things. So that's something that really came out well. And it came out so well that as soon as it was done, I gave it to Mr. Tinston's folks, and now they run it. And it's going to endure as part of the EHR landscape.
That's fantastic. A great use case there. And again, I think a testament to having a modern environment and continuing to modernize so that you can scale when you need to scale, et cetera. I think everyone is thankful that this journey that they've all been on to get out of that technical debt has really been paying off. Nick Saki at Pure Storage. Let's talk about a specific use case that you'd like to highlight in regards to healthcare in the federal community.
Well, as we've discussed across this panel today, the volume and velocity of healthcare data has particularly accelerated throughout the pandemic. And what we answered the call for among our partners within the federal government and in private industry and across the state governments is how do we help them shorten the time to value on that data and maximize the amount of analytics and applications that they can apply against that data. So in particular, at the outbreak of the coronavirus, there was a tremendous spike in demand for analysis and sequencing of the virus itself. And we were able to partner with Health and Human Services and a couple of other agencies and companies to help increase the number of sequencing runs that they could perform per day, as well as do correlation and analysis of case data from across the country, and then helping to aggregate that data to produce the COVID dashboards. And we were doing this all off of literally a handful of different systems. But to bring that data together and to be able to serve it to a disparate group of application processes to help everybody from scientists and clinicians to policymakers have a unified view of that data, and to be able to adapt their views of that data as the data changed really accelerated the acceleration of decision making and obviously insight and awareness to the nature of the disease, and ultimately getting to a cure faster. So it's one of those things where we build probably the least visible thing on a car. We build the tires, but it's what enables the engine and the driver to be able to perform, tremendously well in the race that is for curing these tremendously difficult diseases. So these are lessons that we learned from obviously cancer research and other areas of biomedical sciences, and of course, our support for and partnership with Epic and with Cerner in terms of electronic health records. It's simply making the data move faster in larger quantities to enable faster time to insight and faster response to medical care requirements.
A great use case, and really, again, sort of moving away from having to wrestle with storing the data, enabling the data, transporting the data, and really focusing on using the data. In this case, a very important topic. It's a fantastic use case. Bill, how about speaking of the data, speaking of the records, you all, again, been on a great journey there, a lot of success. Give us a specific program that you'd like to highlight, an element of maybe the overall macro program that you're working on that you'd like to bring to the attention of everyone.
Oh, there's great stories being told, and I'll tell you, it's inspiring to me. I'm a defense acquisition guy by history and trade, but as my beard turns gray, so I love programs, and I like to talk about the specific programs and program successes, because that's what you do in defense acquisition. You deliver a program, you manage cost, schedule, and performance, and you get stuff there. But as I turn gray, and as Nick brought automobiles into this, I'm going to give an example of what really excites me about what's happening in health IT and our support. I was at Costco the other day, and I was waiting in line to get fuel for my vehicle, like everyone else was, because there was a breakdown in a fuel supply chain system, right? And I watched the Bentley pull up, and it was actually a Bentley. There's a young lady in a Bentley, and I was thinking, wow, she's got to wait in line with everyone else, because the problem is in the fuel supply chain, right? So generally, what our interface to the fuel supply chain as individuals is we go to the gas station with that's the most convenient, the lowest price, has the best fuel, whatever, and we go there, and we don't think about anything about the entire supply chain that gets that fuel to us, and that's right. And that's what I'm feeling and seeing and hearing in this group, right? With the work that ONC is doing, with the work that the CIOs are doing, and the work that our industry partners are doing, we're getting all the capabilities here to make it about getting the data where it needs to be so that providers can deliver the right healthcare to patients and beneficiaries when they need to have it. So not talking about specific programs, not talking about specific use cases, just knowing that collectively, because we're all the IT people, right? We all do enterprise IT in some form or fashion, and we love to talk about it. But when the people we're supporting just know that they're going to have what they need, and they're not worried about the name of our program, they're not worried about MHS Genesis, they're not worried about what the Jake is doing, and then they just know that they're going to get that virtual microscope or whatever it was, that awesome use case you said. When all of this ties together, when we're not spending months and years building the interfaces, we just know that all of these pieces are going to result in an operating fuel station, an operating healthcare delivery system that people can enter, make choices about where they want to enter, and get the services they need, and come out feeling better and get the record out of that. That's what excites me. And I know, Luke, you asked for a very specific use case I just was so excited listening to everyone else's, because it all builds to this frankly magical use case. And I'll give this example. On the DoD side, building out and doing their deployments, there was a need for max vaccination capability, right? And as we deployed, I think it was 3 waves ago, they put this mass vaccination capability. It dropped vaccination times down to the floor. I think it cut them by 80% or something like that. It was initially used at Camp Pendleton with new recruits coming in, or actually it was, I think, units getting ready to deploy, not new recruits. But it also went to MCRD. And immediately that was turned around by the company that developed it with DoD to make sure to meet that DoD need. It's now part of a commercial product, and it's supporting the delivery of COVID vaccinations nationally, well, internationally, frankly. And that's the kind of standards-driven, infrastructure-driven transformation I'm seeing in health IT. We're now just talking about the capabilities, and we have providers and administrators of health systems that just expect us, the people on this call, to give them the capabilities they need. They don't want to hear about programs. They don't want to hear about IT. They want to hear about what they can do, and they want to know that they can make the best decisions they can make without going to talk to the IT people and asking if they can deliver healthcare the way they need to.
Right. Yeah, it's like a data scientist that doesn't have to spend all day wrestling with the data. They can just start using it. And speaking of a use case, Captain, let me go over to you. You made a great point about the pathologist and you know, that they're sort of scraping that away, letting them focus on the issue so that they can put their mind on that, if you will. But tell us about the priorities. We're going to shift to priorities, and well, what do you got on your top 2 or 3 that you're trying to focus on this year?
Yes, I think we all have a great question. I think we all have priorities as a group here. I know one of them for us at the Joint Artificial Intelligence Center is to acquire talent because we are at a great need for getting talented people that share the passion of Mr. Tinston and Mr. Flanders to bring data and capability and source and of course AI to bear so that we can use it in the delivery of healthcare. One of our priorities besides the talent is to keep the human at the center of all of this. You started out the conversation appropriately so with the concern that folks can take AI and sort of have a dystopic view of what that means when it comes to healthcare. Well, our team at the Joint Artificial Intelligence Center recognizes that, and not to take away from any of those concerns, we have policy folks in place. We have ethical standards that we are applying to all of our projects and programs. And so we're keeping an eye and a sort of a North Star for us of keeping the human at the center of all of that. So I started out with that use case by telling you that the pathologists were at the center of that. We were just simply, as Mr. Tinston said, just supporting. We're giving the tools, the data, and the equipment and the technology to help them do their jobs better, helping to have the healthcare provider leverage technology and data to do their jobs better. So always having the human at the center, at the intersection of where data and technology, people and the work come together, that's really what we're doing. So as we deploy all of these great and novel capabilities, we know that it'll take the people that are actually using the solution to really be the vanguards for how this gets rolled out. Just to give you a very quick anecdote, but one that's very appropriate to the times that we're living in, and it sort of exemplifies what our priorities are, and that is to accelerate the adoption of this technology. So Rene Laennec, you guys may not know who he is, but those of us in healthcare know that he's the person that invented the stethoscope. Now you see stethoscopes, they're ubiquitous. They're all over the place. Everyone's probably seen one and probably played with one as a child, and your doctors used it on you. Well, he developed that thing back in the 1800s. It took 30 years for people to adopt it widespread because they just didn't understand it. They didn't really, appreciate what it could do. They didn't understand how it could enhance the diagnostic capabilities of a practitioner using this funny looking thing. Well, we don't want that to 30 years to go by before the rest of the pathologists in the community start using this kind of technology. We want to accelerate the adoption. And so kind of going back to those principles that General Groen has sort of laid out for us, accelerate the adoption of AI at scale and in delivering these enterprise services with the help of all of our partners here is really what we're about. That's definitely one of our priorities, keeping the human at the center, looking for talent and accelerating adoption of AI. Those are really our priorities.
Three very important ones, and we really do appreciate that. We're going to take a short break and we'll be back in a moment. You're listening to the Federal Executive Forum on Federal News Network.